Another top story tonight, an announcement made earlier today by Ballad Health, and it's going to have an impact on hospital care for adults and children all around the Tri-Cities region.
Yeah, the change is in regards to trauma care. Holston Valley Medical Center in Kingsport is currently a level 1 trauma center. It will become a level 3 trauma center. Bristol Regional Medical Center is currently a level 2. It will also become a level 3 center. Johnson City Medical Center will maintain its status as a level 1 trauma center.
Other highlights from the announcement today: pediatric emergency rooms will be added at Holston Valley and Kingsport and at Bristol Regional Medical Center, while the first trauma center in the region specifically for pediatric patients will be built at the Johnson City Medical Center. Jackie DeFusco's in your corner tonight. She's been tracking this story all day long, and she joins us now with what the changes are going to mean for you and your family.
Yeah, Josh, Sarah, well, first off, it's critical to note that emergency departments and trauma centers are different. And executives tell me that in the vast majority of cases, patients will continue to go to the Tri-Cities hospital that is closest to them in the region. However, with that said, there are still plenty that have major concerns about the accessibility of higher level trauma care in light of this decision.
First, let me just be clear about our goal. Our goal is to save lives and to improve quality of life.
But today, some community members just aren't buying it.
I think that money plays a large role in the decisions that are being made. And, I think that everybody's concern is that it may be money over lives.
Executives acknowledging that millions are at stake if they continue to sustain duplicate level 1 trauma programs in both Kingsport and Johnson City.
And that's the issue. Do you keep duplicating what you're spending and not provide what's needed, or you reduce the duplication that's unnecessary and then take those dollars and invest in what's actually needed?
But many have major concerns about the soon-to-be longer distance to level 1 trauma care as a result of this decision, especially for rural areas.
In our area, this timely access to care is very difficult to achieve.
They say Holston Valley Medical Center is in a more central location and would have been a better choice, but executives say they have plans to address this.
The point I'm making, we have delays in treatment today that are happening because we don't have a coordinated system.
When they say coordinated system, they mean a new medical call center that they say will streamline communication between emergency medical services and hospitals. Plus, they say of all of the trauma cases at both level 1 centers,
only 20 cases were impacted by distance. Less than 0.5% of all of our trauma cases, distance would have been a factor.
Executives say the distance issue would have been reduced by a coordinated system.
I think that it could be done, but it would require a great deal of dedication, a great deal of work, okay? Because these decisions have to be made very quickly, because these are, in many cases, life-threatening events.
And executives say they know that this will be hard work, but now that they have announced this decision, they say that the very next step is to collaborate extensively with EMS across the region in order to develop comprehensive protocols. For now, live in Johnson City, Jackie DeFusco, News Channel 11, in your corner.
Jackie, thank you. Now, these changes not going to happen overnight. Ballad Health made it clear today they expect the implementation process to take about a year. And now to King.